Yeah, so Warihana, take it over. It's all your meeting. We're so grateful that you're here and are having it with us.
Okay. All right. Thank you, everyone, for joining this call.
Hmm.
I already provided background to this funding in our Discord channel. But the reason why we are meeting is to further discuss, especially on the questions that I need your input in.
Hmm.
I'm just going to go straight to those questions so that we don't spend too much time on the call.
Yeah,
Okay. So maybe I should just share my screen so
sure.
that everyone sees. Yeah.
Hmm. Great.
All right. Perfect. Okay. So here it asks for the project location or locations.
Hmm.
Salam mentioned that we can still stay in the northern region.
Hmm.
I don't know if you can speak more on that and just give us an idea on the locations that he is looking at.
Hmm.
Yeah, Salam, over to you.
Okay, so the project location is so they are asking for country, province, district, etc. Yeah, so it will be the province will be northern region.
Mm-hmm.
The district is currently Gushegu,
Mm-hmm.
and so when you talk about the health hubs, I think to uh, to be able to bridge the current health gap within a district, I can't tell offhand how many health hubs we will need within the particular district. For instance, taking Gushego district, for example, where from one end to the other end of the district is about 3 to 4 hours drive with far less health facilities. So, and looking at this particular grant application you are going to submit, it depends on the amount you are asking for and how many health hubs that can build. If it can provide five,
Wait,
six, seven,
I'm
eight.
sorry. I'm sorry. Could I interrupt for just a second, Slum? Because I did some work on this as part of the implementation strategy. And I want to clarify this because Warahana and I had different discussions beforehand, etc. So, is what happened is Warahana and I talked with the Presidio earlier yesterday, if my days are correct, and we said that we were going to try for 2,500 or 25,000 US, USD, and we were going to try for between 5 and 6, health hubs in that budget range. Well, when I went back and I started looking at the implementation plan and the prices that we had put on things, Salam, I realized that the funding of 250,000 was too little for
Mm.
the initial capital in that. So there are two pieces. One is the operating expenses for year one, and the other is the capital expense for year one. So as what I did was I elaborated on those prices and broke them down so that it was per health hub. And so
Mm.
for the first year, so not only the capital expense, things like beds, Starlink, etc., the actual structure itself, chairs, paint, etc., but it was also the nurses' first year wages to get them off to a solid start as an entrepreneur, and also the training that they would need to become a comprehensive and performant proficient, proficient entrepreneur. And so there were all those numbers in there, and then there was the money for the typhoid vaccine and hepatitis B. there was malaria. All of the things were in the implementation plan. And so what I ended up coming up with when I broke it down per hub was a number of, what was it per hub? The presidente's going to get it. I can't remember out of the document.
342. 342.
300 for 2 hubs. Yeah, so if you divide that by 2 is what? Can you tell me really quick?
Well, no, you had the 684 total, and then divided that into was 342.
Right, but okay, so okay, let me back up. So do the math on that real quick. Divide that number by 2 for me. The thing that I came up with, and I don't know if this is right or wrong, you guys have to tell me, is when I did the implementation plan, I made it as if Give Basic Needs was going to do 2 health hubs for a total of 684, and then I'm sorry, 642. 642?
684.
Jesus.
But you told me to take 342 and divide that.
3 okay. So is what we're going to do is the Give Basic Needs was going to invest 342,000 to put up 2 health hubs. And then we were going to ask the grant opportunity, in this case ACT, to put up 342 to put up 2 as well. So we were showing them that we had skin in the game by putting up 2 health hubs and them putting up 2 health hubs. And so that's kind of the numbers that I looked at, and why I wanted everybody to look hard at the budget is because I was trying to get it reduced down into how much is it really going to cost to do 1 health hub. And I think when I come to that conclusion, I realized that 250,000 was going to do 1.5. So that's why I said that we should try to split it, and we'll bring more to the table and hope they can bring 342,000 to the table for their 2 hubs.
Okay.
I don't know if that's right or what we need to do. I did my best trying to get everybody's approval on that with regards to the budget, and that communicated, but I don't feel I communicated that well. So we should just take a minute and talk about, before Salam goes on, about where they might be located, to say, is the implementation plan accurate for the implementation cost of 1 hub at 171,000 for the year? That includes the infrastructure to build it out, the supply of medications, the initial supply of medications, the initial vaccines. That's like $50,000 in vaccines of typhoid alone, I believe, if we look at those numbers. And then, so we just have to decide, is that bigger than what we thought? But included in there are things like the delivery expenses for the supplies, the resupplies, the media, the local products, development, like the moringa development, the neem, is it neem? Meme. I can't, which is it?
Yeah, neem.
Yeah, sorry. The neem development, and having those co-ops started, there was $12,000 in there for the whole year. And so it's kind of, that's what I had put together, and what I think we just need to discuss. So I don't want to run your meeting or ruin your meeting, Warihana, but I just wanted to communicate. That's why when you said 250,000, I was like, wait a minute, the number is really the 300 and 342 number. If we want the grantor to do 2 hubs, so then we would be doing 2 hubs, they would be doing 2 hubs, and then I don't know how everyone feels about that. It's really about the people in Ghana. It's about Ben, it's about Salam, it's about Warihana. And those budget numbers, because that includes the well. Some don't need the well. That includes the truck. That includes everything for delivery. And some of those things we'll have already purchased, but those will go to our credit for how much we put into the project. Does that make sense? Or should we not even think about it that way? and I'm making it more complicated, or I was trying to make it simple. I don't know if I've done that or made it more complicated.
No, I think what you've done is very exhaustive, because you've looked at the various components that all come together to get the hub functioning,
Mm-hmm.
uh, including um, okay, including the stipends for the RNs.
Mm-hmm.
It's you know that the grants spoke about health screening.
Mm-hmm.
I don't know if that was also included in the
Yeah,
budget.
for sure, because it's this idea of tests for hepatitis B, hepatitis
Mhm,
C, and HIV. And then if they're
mhm,
negative for B, we vaccinate them.
mhm.
And if they're
Okay.
positive for any of those, we ask them to seek additional treatment. So,
But I think what Warihana is saying, like in this budget, there's nothing for prevention or the education. Is that correct, Warihana?
Yes. So I just want to know if the health screening exercises, the cost of that have also been factored into the budget.
uh, I think I, I, okay, so let me back up 1 second more. So, I created the implementation plan, and correct me if I'm wrong, Salam, with Salam's help. We went through and we said, okay, it's going to be about 5,500 to 6,500 to put the well in. So I put that as a line item. Now, all
Mm,
of the details under each of those things have not been flushed out. Like, for example, when it comes to the education of the RN nurses, we know that we need to educate them in basic financial transactions, banking terms, inventory control, marketing, maybe human resources, like if they take on additional staff, all of those things.
mhm,
But each individual bucket, if you will, hasn't been broken down. Is that
mm.
the way that you looked at it, Salam? So it's a little bit sloppy in that every bucket hasn't been defined, but I think that it's a good start. I don't know. Salam, can you comment on that as we worked on those numbers together? And then I had, okay, okay. And then then Ben as well felt, I think when you looked at the numbers that they were accurate for what it was we needed to do in those areas. If you think that they're overblown, like we can do the well for $3,000, then we should change it. But I just put the numbers in that Salam gave me essentially on what we thought it was going to take to execute that. So Warahana, if you're looking at those numbers and see something off, let's talk about it and adjust it. But I don't have the actual all the individual details. I just have, for example, and I don't have the document up. I should have it up.
What's the 3 pages you sent me?
Probably not. Like I said, I'm not trying to take over your meeting, Warhana. I'm just trying to explain what it is I did so we can see if it's valid or not. So, for example, when you look at uh, like for example, when we look at the budgeting and we look at the timeline for the launch, you see in there we've got the borehole, the installation of the pump. Um, we have the structure construction. We have the walls, the roof. We have the hand washing station. We have the fleet truck. We have the circular delivery route. We have the verifying of the gear to keep the temperatures of the vaccines proper. Um, I don't know, without reading the whole document, I'm not sure how to
Yeah,
explain.
Karen, yeah, I mean, it's fine. I get it. Um, I think the figure you are quoting is okay, and in the grants they spoke about matching funding. So I like the idea that we are willing to set up two, and then they also set up two,
Yeah, that's
or
kind
we
of what
use.
I felt. I mean, it's a lot for us. but we can do it if they're gonna come in. I don't know if we will be able to do two this way without them matching. If they match it, we'll match it.
Mm-hmm.
But we might have to cut some things out of maybe we won't be able to provide a year's worth of staffing fees or stipend fees for the RN in the first year. Maybe it'll have to be 6 months. I don't really know, but I know if they come in with half, we'll match their half, and they match our half. We can do this.
Okay. Yeah.
So that's kind of how I came up with four. We do two, they do two. I also felt if I was a grantor, I would like to see that.
Yeah, I agree. I agree. And this is an application. At this stage, they are not even asking for a lot of detail. They are just asking, well, not a lot of detail. So, and we want to make the application appealing to them. So it's fine. Your numbers are okay. But let's hear what Salam has to say.
Mm-hmm.
Okay, so yes, on the borehole, I think that's actually the actual cost. And pardon me if my energy is a bit low on this call. I haven't eaten for the evening.
Oh my gosh.
Okay, so with the overall budget of 171K,
Uh-huh.
I think is good. Um, I have an opportunity of seeing a number of um, uh, contracts when it comes to cheap compounds,
Uh-huh.
which is just similar to what we are going to put up. So
Yeah.
when it comes to the infrastructure cost, because I haven't seen the drawings,
I'm still
I
working on
can't
that.
really
Sorry.
speak to the specifics. Yes, but I think governments, when the local assemblies award cheap compounds for 1 million Ghana cedis, and 1 million Ghana cedis is about $100,000.
Okay.
And these contracts usually, I believe, are priced that way because uh, government payments are not as prompt, or it's not upfront.
Mm-hmm.
You finish the project and then they now pay you. So it may take you even 6 months to get your payment. And so I am looking at the overall cost of, let's say, if a chip compound costs $100,000 for government to put up, and then I am discounting that by, say, 10 or 20%.
Mm-hmm.
So that brings it back to about $90,000 or $80,000, and we are budgeting $171,000. That means we still have about almost $80,000 to $90,000 as well to furnish, to pay stipends, buy vaccines, and all of that. So overall, my comment is that I think the budget of 171 is good. Though I haven't seen the infrastructure drawing, but we are not looking at something too huge. And
Right.
maybe I think Warihana has visited some cheap compound. I think they are just about 3 rooms, a waiting area,
Mm-hmm.
and yeah, it's not. Maybe Warihana can confirm this, but I don't think they are that big. So we don't need something so huge.
Right.
I think the budget is okay for me.
And I think the other thing that I wanted to do in the budget was, as you'll see, um, Abbie, can you post those three images in Discord? I sent the president 3 images of the budgets. It might allow everyone to look at it again. Just drop them in the health hub. Um, but when you look at it, I wanted to make sure that we had enough money to truly subsidize the typhoid and the hepatitis B vaccines. So there's literally $50,000 in vaccines there alone.
Okay.
Let alone the supply chain logistics, but also the deworming medications. There's 10,000 for. So if you look at it, there's at least $60,000 there in literally in medications that will be subsidized. So Salam, if you're saying 100 for the building infrastructure, getting everything together, and then we're talking about 60,000 in medications or vaccines, and then paying a $32,000 stipend. 171 is right there.
Yeah. So but I think that the structure cost may come down because this is not a contract we are awarding to someone. We are putting it up by ourselves.
Right.
And
that's
contracts usually go with a profit margin for the person, for the awardee.
Yeah.
And like I said again, the interest for time for the period of payment is also factored in.
Right.
So, and also when you look at it, I like the fact that you've allocated about $50,000 for vaccines alone, because that will give us some flexibility when it comes to working capital. Because I'm actually trying to make sure we're able to get the vaccines at a very cheaper price. I'm engaging a number of people. I spoke to someone today in Accra who also sound promising with the typhoid vaccines.
Great.
So if we're able to get it cheaper and we're able to train the RNs to roll the vaccines out and take something small,
yeah,
that's what they may take may go to offset the monthly stipends we'll be giving them, or augment our budget for the next supply of vaccines. So I think that gives us some flexibility when it comes to working capital. So basically a grantor, knowing that the actual cost of a cheap compound is about $100,000, because this is public information, and seeing that you are going to procure vaccines, medications, equipments, pay stipends, and you are looking at a holistic cost of about $171,000. I think that should send a message of efficiency. And so I think for me is good. We just have to find a way to be flexible within the budgets, but make sure we stay within the limits. So that is why I first of all said that I don't think we should go for something huge when it comes to the structure. We can just mimic what is already done, but more cost effectively. That gives us something.
Yeah, and I think, Warihana, this might be new to you, but I've said it 1,000 times to Salam and probably at least 500 to Benny, and the Presidency's heard it 20,000 times. But when we operate on any project, we always under-promise and over-deliver. And that's what this budget is meant to do. It's meant to say, look, we didn't need 171. We only needed 161. And we didn't just give 1,000 typhoid vaccines, we gave 1,500, right? So it's about never going back for more money. It's about under promising and over delivering. Does that make sense, Warihana?
Yes, it does.
Yeah, and that's how we're successful, is by having that motto in everything we do. And like I said, Salam, how many times have you heard that one?
1,001.
Yeah. Now you have 1,001. Yeah. So but it's a very important thing, is that we don't want to undershoot on this. We want to make sure the first number is our best number, and then we over deliver. We do, like I said, we don't do 100,000, or we don't do 1,000 vaccines. We do 1,200. We do 1,100. Whatever it is, we exceed what was expected. And I think that's why I came up also with the number, is there is a little bit of leeway in there, but at the same time, there's a lot of unexpecteds as well.
Yeah, the number is great. Yeah, we can work with that.
Okay, good. And so, Warihana, and before I get to Ben, because I want to ask him, but Warihana, you like the idea of 2 and 2? We do 2, they do 2?
Yes, I was actually thinking that before coming into this meeting, because they say it's a matching grant,
Mm-hmm.
So if we're doing two and then they are matching us up with two, that's like meeting each other a perfect halfway spot, which is really
Yeah.
great.
Yeah. And I think the benefit in doing it this way is that when Salam goes to procure medications or vaccines, he will be doing it for 4 hubs, not just 2. So he should
Mm-hmm.
be able to negotiate a little bit better price.
Mm.
And so by having 4 instead of 2, we should actually help take economies of scale into effect when we're purchasing inventory for the smart grid and the distribution of our supply chain, which
Mm.
means more
Okay.
profits for our staff, our RN nurses, entrepreneurs, and it also means just more success in general.
Yeah, I agree.
Okay, good. So I hope that that level sets everyone. Benny, do you have any thoughts on that?
Not really. Yeah, I think I'm following, and the budget looks okay to me. I'm
Okay.
looking at, yeah. So I noticed that it was divided into two. We had the capital expenses, then the operational expenses.
Mm-hmm.
Yeah, and putting everything together, the value we have to kickstart for the whole year, I think it's okay with me.
Okay.
Mm.
Now
Yeah.
I want to be straight up with everybody that if we do 3 events in Ghana before the travel in April, and we do 2 health hubs at 340,000, we will be done, overdone in Ghana for the year. I just want to be straight up so that Salam knows, Benny knows, Warihana knows, unless we get more funding. I'm all up for the match thing. If somebody wants to come back and say, look, do 2 more hubs, we'll do 2, you do hub. I'll try to figure that out. But that's a lot of money. So I want to
Okay.
make sure that everybody's aware of that. And I know Warhana is going to go write more grants, and that's going to be amazing. But I'm just saying, just so you know, if we put 340,000 in, it's a lot of money. And so we should just be aware that we won't be doing a lot of giving events. We'll be focused on making the entire team will be gathered around making the health hubs successful. So I just wanted to be clear on that.
Mm. Okay.
All right, sure. I think that's
Yeah.
understandable.
Great. Great. And everybody agrees that strategically this is the way we should go until, like I also say, you go until you decide not to go, right? We're going to go with this health hub idea until either it succeeds wildly or it falls on its face and we stop doing it. I'm hoping that it's going to succeed wildly, but I want to just, we're going to go at it hard. We've already committed to that. And so I want to make sure that we have the resources available and we're not doing other giving events that are going to take away from it. We have the travel ones that are a little bit of an exception because we want to show our potential donors that this is what we can do. And so we're going to continue to do all those. But I just wanted to make that clear from the CFO hat. That was my CFO hat.
Yeah.
Yeah, so I think the 3 giving events you are talking about is the travel events, just to be clear.
Yeah.
Good.
Yeah.
Good. So I think that is okay.
Yeah.
I just wanted to
And
also.
the thing with those, just to make everybody understand, is that basically they donated, each person going made a donation of $450. But I can tell you that when Salam submits his purchase invoices for those events, that will be eaten up in the first half of one event, probably. And so let's be honest that Give Basic Needs is funding those events.
Yeah, I
Okay.
understand.
Okay,
Yeah.
good.
Yeah.
Good.
Yes.
Because
Yeah. I also think if we're able to kickstart with the health hubs, even with 2 or 4,
Mm-hmm.
if we're able to secure this, I think it will keep us busy the entire year because
Yeah.
there would be a lot of things to be doing along the whole process. So
Yeah.
yeah, I think that's okay.
Yeah, I think that's great. And I want to just throw this out there from the CFO hat as well. I talked to the president about this, and I said, if we land this grant, I think that each of you will end up probably with an assistant because Benny's going to have more work, probably too much. Salam's going to have too much, probably. And if Warihana is going to keep on bringing us, the cash, then we're going to have a lot to do. So we don't want to slow down on every front. This is how we grow, right? So just be aware and have those mentees ready that we're getting ready to grow, and it might mean hiring 3 more people if we secure this grant, and that will also drive up our operating expenses. But I feel that's something we need to do because that then proves us to the next grant opportunity, if I'm not mistaken, right, Warihana?
Yes, that's correct.
Yeah. So that's kind of what we're thinking, whether that's a grant assistant for Warihana or that's just an assistant. I mean, a secretary that does everything you tell them to do. And that's whatever. The same thing for Salam, the same thing for Benny. And the one challenge that I have is, and I don't know how to do this, and because now you all can put your board hats on, we'll all put our board hats on as board members. As board members, when we talk about growing the organization, we have one bottleneck. Does anybody know what that is other than the president? Other than funding, that's always limited, right? But I mean, other than that, what's the one thing that we all have to be proficient at, including new hires? I'll give you a hint. It's called Smiley. And so we all have to be proficient. Yeah. We all have to be proficient with ERP Next. So Salam, if you hire a helper to help you create purchase invoices and work through some of that, then they need to understand Smiley. They need to understand ERP Next. Benny, the same for you if it's around compliance or whatever. So we're going to need somebody on our team who is going to be the ERP Next trainer. And they're going to need to be the person, like, for example, right now, Benny is kindly helping out Warihana because I don't have time with some things that are happening in Smiley. So Ben is kind of training Warihana on some things that are in ERP Next. Well, I can tell you that if we bring on 3 more people, if they're going to be productive, they're going to need to know how to use ERP Next. And so if that's the case, we're going to need someone to be the ERP Next guru who's going to be able to take those quote unquote support questions from those individuals and help them work through that. And there's only, right now when it comes to knowledge on ERP Next, there's only 3 people that really know multiple parts of it. That's Benny, myself, and the President. And so we're not sure how this is going to work out, but keep your board hats on and keep thinking about it because that's our biggest bottleneck. We need to have users who are proficient with ERP Next, whether it's checking boxes on tasks or creating purchase invoices or requesting payments or whatever, creating invoice, whatever it is, we're going to need that big time. So I'm not going to derail your meeting anymore. I'm so sorry, Warihana. It's all back to you.
Okay.
Sorry.
Sorry, please go ahead, Kevin. Feel free.
No, I was just gonna say, I want to just say a yes or no. Do you agree with my statement that if this organization is going to grow, that we need that trainer a part of this organization? Benjamin, do you agree?
Yes, I agree.
Okay, Salam, agree or disagree?
Yes, I agree to that.
And Warihana, you agree or disagree?
Yes, I agree.
Okay, great. I can stop now. Sorry. Thank you. Thank you, everyone.
Okay. In fact, this discussion was actually good because that would have been the next section we would have come in, the budgeting, the funding. So it's great. So now we can piggyback into the project's locations, and then Salam, please go ahead.
Yes, so I think the location, you should add Ghana to it. I can see your screen, so I saw that you just wrote Northern Region, Gushegu District, yes. So,
These are just notes that I'm writing. I'll reorganize them.
Okay.
Okay.
Mm.
So I think that settling on Gushegu for 4 is okay. If you need specific communities, I would get you the 2 more communities because we've already settled on 2 communities that we are setting up the first 2 with. So yes, with the location, I think Gushegu is fine. Because at the end of the day, we should be able to prove that we actually went in and we breached a health gap within the municipal, and we are moving to another district, or we've breached the health gap within a region and we are moving to another region. Because I think the thing with most NGOs is that there was this conference I attended last year, and the conversation was about how there is about 70 to 80% of all NGOs in Ghana concentrating in the northern part of Ghana, the northern sector, the 5 northern regions. Yet, every year in and out, the northern sector is classified as the poorest. And all these NGOs come in the interest of they are going to help. And so I think that it will be a good niche for us if at the end of the day we can tell our story differently, that we went in this area and we've done this, and there's evidence to it, and the results actually show from district to district, from region to region. So that was why on Discord I suggested that let's still stay within northern region, um, show our impact real there before we move to another region. So with the location, this is my opinion on that.
Can you comment, Salam, just so I have some concept of how many people are in that region? Are we talking about 100,000 people, or are we talking about 500,000 people?
You mean northern region?
Yeah, but the description that you have here, if you drew a map around, if you drew a circle around it, how many people would fall in that area?
So we're
Northern region.
at the northern region. In this case, it will be the Gushegu
Oh,
district.
Gushegu.
Yeah, it's a municipal. Yeah.
Gushegu Municipal, we should have Gushegu Municipal, we should have close to about 700,000 people.
Okay. So
Yeah.
I'm just thinking, if there's 700,000 people, 4 is not overdone. it probably could be 44, and it probably still would, you still be trying to reach people. But I'm just trying to size it up, But if there's 700,000 people and we're talking about 4 health hubs, that's there's still a lot of work to do there.
Google says they are about 160 people
160.
as of the 2021 population census. So
Okay.
let's say maybe,
I think the figure was about northern region, right?
yeah, we are looking at the Gushegu Municipal, since that's where the hubs will be situated.
Mm-hmm. So I'm sorry, Warihana. So how many people would be in that region then?
Districts.
Yeah, that municipal, it should be 250,000 or even 300,000.
Okay.
Yeah.
So I don't know. I would defer to all of you, but it still seems like 4 isn't overdone for 300,000 people.
I wouldn't think so.
I wouldn't think, but yeah, I think Warihana and Benny, you should comment, and Salam, you should all comment.
I think Gushegu Municipal it's very big. Yeah, that's why when you asked me for the languages of some of the basic thing, I had to defer to, because it even consists of different tribes within the same municipal. So you get to a place, they are speaking a different language. You get to another place, they are speaking a different. So I think it's big, and 4 wouldn't be too much for that municipal.
Okay, great.
I agree, and I like the point Salam made about NGOs most of the time, like they don't build sustainability in what they do. Like
Mm-hmm.
NG, they just come, they want to get the numbers, and then they go somewhere get the numbers as well. But if
Right.
we are on the Gushegu Municipal and we actually establish four, with the four, we'll be able to reach a lot of people and actually address the problem that we are there to solve.
Mm-hmm.
And in the future, if we get other grants, then we can move to another municipal.
Yeah, absolutely. Yeah, and I think that to Salam's point about not moving until we succeed in one small area, I think that's smart. But I think that just like we're gonna say we're gonna do two, we can say we've done this region with four. How about if you do this region with four to a grantor?
Yeah, like a future grant, right?
Uh-huh. Yeah.
Uh-huh.
So
Yeah.
now we kind of level up. We say, okay, we were successful with two. We paid for two. ATC paid for two, if we even need to say that. But we've been successful with four in this region. Now let's go. We want to work with you, Mr. and Mr. Grantor, and we want to do an entire region. We want to do four in a different region,
Hmm.
and then ask for the 650,000 or whatever that number is.
Okay. All right. This is settled then.
Mm-hmm.
Moving on. Okay, so now let's look at this. The target audience, of course, we're looking at youth, women, girls, um, pregnant women.
Mm-hmm. And to be honest with you, like when I was going through doing the implementation guide, I was thinking about putting, like, when Warihana and the president and I talked yesterday, we talked about maybe like CPR dummies that you could demonstrate how to do CPR, or for the nurses and maybe even the community, but also for breast exams. The president pointed out that there are mannequins or
There's kits that resemble a breast, and you can feel it, and it shows you like different levels that what a lump would feel like and what to look for.
right. And so these teaching tools, I didn't put any of those into the implementation plan. That doesn't mean we won't do them. It just means I didn't put a specific line item for that. So if we want to do something specific for some type of birthing kit or educational thing, we can definitely do that. I just would caution that we may need to revise the budget up a little bit if we're going to do a specific line item for that, and we want to go hard on that. That's up to the group. I just want to be clear on that.
Mm.
So like I didn't choose a staff. I didn't like, well, I put the RN stipend. I didn't put a stipend for a midwife.
Mm.
We absolutely could do that. In the future, we could split that category into 50-50, 6 months for each until they get on their feet. But I don't know if that's desirable or not. That really has to come from you guys.
Mm. As for the 171,000 USD,
Mm-hmm.
um, I want to suggest that we go with that.
Mm-hmm.
I think with that we have some room for adjustment,
Uh-huh.
and when we even come to implementation, it's mostly left to our discretion.
Uh-huh.
Yeah. So.
Yeah, so I think that that's good. And I think that if there, I mean, as you pointed out, there's a second part to this application after the
Mm.
initial approval. So we could even flush out the pregnancy support role of the project at a later date.
Yeah.
Yeah, I agree. We should do that. And if we need to do that, we can do it then. And I agree we shouldn't revise the number.
Okay. So the target audience, I have youth, women, the nurses that we are going to support or
Mm-hmm.
that will man centers,
Uh-huh.
children, pregnant women.
I think you had said yesterday disabled how do we say it? Disabled mobility.
Mobility issues.
Yeah, those suffering from mobility issues. One of the things,
Physically
Benny.
challenged- Is it physically challenged in the individuals? Or
Hmm.
is that the name?
Yeah.
Mm,
So we talked, Benny, and Salam. We talked about maybe at the event, at the hub, we could have things like canes or walkers for people who have mobility issues. So that's what we were just referring to.
okay. All right. Now, the number of direct beneficiaries, assuming that the population of the Gushegu Municipal is 200,000, if we take 20% of that or 30%,
Mhm.
that's 60,000. Let's increase it a little. Let's see, 40. Okay, how about 80,000?
So Warihana, is this 80,000 across 4 health hubs, or is this 80,000 across two, or is this 80,000 per one?
This is across 4.
This would be for four.
It's
Okay,
small,
go
the
ahead,
funding.
Benny. Sorry, do you have something?
No, sorry, go ahead, Benny.
Yeah, so I think I was about asking the same question, that this grant we are applying for, how many health hubs is that going to cater for? Just only for the grants, the amount we are applying for. Is that
So
for
we
the
are setting up 2, and then the grant will set up 2. So 4 in total.
okay? So what we would be working on here would be numbers that the grant would support to be able to take care of, right?
No, so we are looking at all 4.
Oh, okay, okay,
So then
yeah.
if we divide four, then we're talking like 20,000 people served per hub in 1 year.
Mm-hmm.
Okay.
Is that what we're thinking?
Yeah, yeah, 20,000 per year. I don't know, Salam. What do you think about this number?
I think the number is huge.
Yeah, it is big. It is
Yeah,
I want to do it right now, but I don't know. That's a lot of people. Uh, um, I'm just
yeah.
well.
I
Let's.
think these are remote communities, and yeah, while that population may be available, but it's not everyone that is going to show up. And I think we should be realistic. We should be very realistic, because if you say 20,000 per hub, that means we are talking about 1,500 people
The reason why I put that figure is because
a
of the
month.
health screenings that we will run.
Uh-huh.
Okay.
If
Yeah.
you're
So
running screenings, you can reach a lot of people at a go.
okay. So I think if that's the case, then I think maybe the numbers will be justified in your description or your proposal stage or whatever. But
I've reduced it to 40,000 though.
yeah, shouldn't I don't think that we should associate it all just to the health hub. But our health screenings do record huge numbers. So if there's going to be um
But but
this one thing I also think we should look at is that are these health hubs going to be doing screenings
Yes, the hubs will run the
within the
screening.
facilities as people come, or they are going to go out and do screening events like how we do?
no,
Because
they're
how
not.
we do
Yeah.
screening events is what brings us the huge numbers.
Mhm. So,
So
so
I
one
think
one thing that I want to caution the group on is that the research shows the health screenings, they're important, but it's the testing that we need to be careful with. And so the only thing that we should be testing for is hepatitis B and C and HIV. That's the only thing we should be testing for. And if we find they're negative on hepatitis B, we should immediately inoculate them. Everything else should be, instead of, I mean, we can have health screenings for things like blood pressure and sugar, diabetes, these kinds of things, educational about breast cancer and CPR and all of these things. But I want to be careful that it's not the massive test events that we've been doing in the past. This is a different kind of, this is a treatment, not a testing. And so we will be, instead of giving uh, tests for uh, typhoid, we'll be giving vaccines. And that's where the $50,000 comes in, right? So maybe the $50,000 is at the event that we probably, rather than call it a screening event, we should call it a, like, I don't know, health meetup, or I don't know, because there'll be vaccinations involved as well. You could call it a mass vaccination event, but there's more than that there, because there's the blood pressure, there's the um, there is some testing for things that we can't treat, like HIV, hepatitis C, etc. So it's really about treatment, remember, and it's not just about testing. So it really looks different. And to Salam's point, we're, in my opinion, the hubs do not go to the community. The community comes to the hub. So if in that $50,000 or one of these other line items, we have a celebration and it's a vaccination celebration, then we can give vaccinations at that event, or we could test, we can do it, but the people need to come to the anchor, which is the well,
You
the
may have some
borehole.
individuals that are bound home.
Homebound. Okay, so maybe
so
maybe the RN entrepreneur says that she allows time once a week for homebound individuals, etc. Yeah, Salam, you have something?
Yes. So I think data from the community health planning services, the CHIP compounds,
Mm-hmm.
says that CHIP compounds are built to serve numbers between 3,000 to 5,000 people.
Oh, okay.
Yes. So I think we can look at those numbers and have a reference figure.
Oh,
So
so
I
you're
think
saying?
the 40,000.
Go ahead.
I think the 40,000 for 4 health hubs is okay, considering the fact that we'll be doing screening, though we are not going out to do those screenings as we used to. But once screenings or testing is going to be free, if we make it free, then we should expect that good number of people will have a lot of people showing up at our facilities than an average CHIP compound.
Mm-hmm.
Yeah, so I think
Because
the
the chip compounds were free, providing free medicine, or they were asking for a fee.
no, so the CHIP compounds, because they are
Government.
government partnership projects, they take insurance. They
Ah,
take
the
health
insurance.
insurance.
Right.
Yes, but the insurance doesn't cover um, good medicines. So sometimes the facility managers privately procure medications.
Uh-huh.
And if you show up at the CHIP compound and the medication you need is not covered by the health insurance, the national health insurance, or is not available to the facility, then they can sell it to you, or they will recommend you to go to a pharmacy, a private pharmacy, and get the medication.
I see. Okay. So yeah, I don't know what the number looks like but again, I would just caution that with the motto of under promising and over delivering, if we think we can do 80,000 people, let's say we're going to do 60 so that we can have a winning scenario, right? We're setting ourselves up, and we should be setting ourselves up for success, not failure. So whatever number you guys decide on, I'm really fine with that. That's what you guys are thinking, and you have more knowledge on it. My only concern is that we succeed. And so we need to set ourselves up to succeed and meet this goal, whatever the number is.
Yeah.
Okay, so the 40,000 is okay, or we should reduce it further.
What
I think it's okay.
how much okay, let's do this. I know it's a crazy question. You may not know the answer, Warihana, but I'm going to ask it anyhow. What's the probability? How much does the probability of us getting the grant go down if we reduce it by 10,000?
Mm,
Will the grantor just say no way, never going to fund it, or are they going to be
I'm
like,
looking.
I'd like to see some more, but it's okay?
Yeah, I'm looking at the amount that we're asking for, and this grantors, they also have some numbers that they want to meet.
Sure.
In as much as the impact is okay or is good,
Mhm.
they have like an expected number of beneficiaries that they need to reach. Yeah, so let's start with the 40, and we'll see. I don't think we are over promising.
Okay, great. Perfect.
Okay, number
Yeah,
of
Yeah, I think that's good. That only means we are doing the facilities are receiving 30 people a day for a year, which is okay.
okay.
Or
Yeah,
28 people.
that's a good thing, a good way to look at it as well. And we can be open to doing bigger events if we need to make the numbers. I just want to make sure we can make the numbers. So that's great.
Okay, the number of indirect beneficiaries.
Oh.
Who are even the indirect beneficiaries? Maybe the beneficiaries that will use the boreholes, the people that will actually use the boreholes. Is that indirect?
Absolutely.
No. Indirect
Abs-
beneficiaries. Indirect beneficiaries are the households, the communities. The direct beneficiaries are the people who comes to the facilities. So if I was the father or the breadwinner of a family, and someone within the family that I cater for is sick, and Give Basic Needs is able to treat this person for free, I become an indirect beneficiary because I save some money.
Mhm.
So usually indirect beneficiaries um, are more than the direct beneficiaries.
Yeah, I agree. I agree. So if if I just walk to the well and get water every day, I'm an indirect beneficiary because the reason that the well is there is for wash and sanitation for the hub. It's also there for the
Yes.
community, but I'm not actually getting medical services. I'm just getting free clean water, which is a human right in my opinion anyways. But so I would call that person an indirect. Would you, Abbie?
That was direct.
That would be direct. I don't, I'm it's kind of confusing, but I agree with Salam that it's a bigger number. When you I'm gonna mess it up. I'm dyslexic. I think you guys all know that. So the neem, is it neem or me? What is it called?
I don't know anymore.
Is it NEEM or is it MEEN?
NEEM, NEEM.
Neem. Okay. Sorry, I will always get that wrong. It's just the way my brain works. But the neem, the beneficiaries of this is what, all of Ghana? Because this prevents the transmission of malaria. Are you kidding me? I mean, how many people do you want to count? If I drink tea that's made with neem, the insect bites me, they no longer transmit the virus. How do you even quantify
You're
that?
looking at the villages.
Right. So it's literally everyone in the village. But beyond that, because what if the mosquito flies to the next village?
And if they don't want to take it, so
If they don't, sure. But I'm saying if we produce a co-op that produces tea that's made with neem, we're able to stop the spread of malaria. I mean, you tell me what that number. I don't know how you'd even come up with that number.
Yeah.
Let's
So I
just come
think
with a number.
when it comes to health, I'm just on the Ghana Health Service website as we talk. So I think they have a metrics. Usually, is the indirect beneficiaries is 2 to 3 times the direct beneficiaries. So if we are estimating that the direct beneficiaries will be 40,000 for 4 health hubs, then it is okay to estimate 100,000 people as indirect beneficiaries. Just like you said, these people comprises of every community member. Yeah. Someone could get, so for instance, if I'm in the community and I'm infected with hepatitis B,
Yeah,
I'm likely to spread it to everyone within the community.
absolutely.
So we call this negative externality, and in this case it is a positive externality because they are going to benefit. And so for every action of good or kindness, it has about 2 to 3 times effect of positive externality, and that is usually what is classified as the indirect beneficiaries of your action. So you might be the direct beneficiary of your salary, but I am an indirect beneficiary because you pay for my Starlink. Just an example.
Yeah, yeah,
Yeah.
yeah.
So I think
And I
100,000.
Yeah, I think that honestly too that I don't know how we'll do the Starlink at the hub. We haven't really discussed that, but that could easily be a partially open network for the entire community to use and use for education purposes, whether it's medical related or a mental, whether it's physical or mental health, whether it's growing and agriculture. It could be used for anything. So yeah, I think you have to use a factor, and I would lean towards the 3 times because we're going to benefit a lot of people with one of these hubs.
Yeah.
Even if you stop the spread of typhoid, I mean, one person can contaminate the entire water source for the rest of the community. Literally everyone.
Yeah.
Yeah.
And with the Starlink example, there is this cheap compound at Nauhugu, not just I think about 40 minutes drive from Gushegu.
Hmm.
Someone, I don't know whether is the facility manager or just a benevolent individual, has gone to mount Starlink there,
Uh-huh.
and every evening I have a friend who works there. He says every evening the youth in the community comes there to talk to their friends on WhatsApp,
Uh-huh.
Facebook, and all of these things. So yeah,
And that's
we
good for
can do that.
mental health, right? Yeah, that's good for their mental health. That's serving the community just like the water is. It's serving them knowledge, it's serving them friendship, it's building compassion, empathy. Yeah, I mean the numbers. Yeah, I think you should go with the factor of 3 at least.
Yeah.
All right. So indirect beneficiaries 3 times 40,000, 120,000.
Mhm.
Okay. So does this project have an existing funder? No, because Give Basic Needs itself is funding the two, and then they provide the matching funding for the other two. Okay.
Okay.
I think you should say yes because we are providing some funding and we are only asking them to come in. Or
When we say funding, is like they are referring to another grantor,
Ah,
okay,
already supporting this project. You know, you can have a big
okay,
project that is being supported by multiple
yeah.
grant.
yes, yeah, yeah,
Right. Yeah, that makes sense. So like if UNICEF was to come in or the World Bank and they said we'll give you 50 towards
Mm-hmm.
this project, it may not be enough to execute it all, so then you seek 50 from ACT or whomever. I see.
Mm-hmm.
That makes sense.
Okay. So now the financials, the total cost of the project. So if one hub is 171,000
Mhm.
times 4 would be 684,000 USD.
Yes.
Okay. grant requested, we are requesting
Half of that.
342. Okay. Okay. How will this matching fund enhance ongoing implementation?
It'll
Okay.
it'll
So,
it'll literally it'll double our impact. Period.
mm,
On
yeah.
everything that we said we were going to do, it will, by them contributing two more health hubs, it will literally double our impact.
Mm, yeah. Okay. All right. How many beneficiaries would your implementation reach with ACT Foundation's matching fund, existing and new beneficiaries if this fund was granted? So if 40,000 for the four, then it will be 20,000 for the two hubs that you would be helping us set up.
Yep.
Okay. And then do you have auditor financial statements? I've just indicated yes because at this point they are not requesting for them.
Hmm. I think that's
Uh,
smart.
yeah, thank you. So I've indicated that our audited accounts are up to 2025, and yeah, we don't have any relations at the foundation.
No.
I'm hoping that by the time we would have to submit our proposals or when they request for the auditor statements, they would have been ready. And from what Salam says, we would get them very soon.
Hmm.
Then so that's all. It's actually a short form.
Okay.
Yeah, short form. So I will just go back and polish everything and
Yeah. Yeah.
possibly submit tonight
Okay.
or tomorrow.
Okay.
Excellent work, Warihana.
Thank you.
Yeah.
Very good.
Thank you. Any
Yeah.
comments? Any feedback?
Yeah. So I think the funding actually fits very well. We are very hopeful that it goes well because
Mm-hmm.
I read on the website that they focus on health and entrepreneurship,
Mm-hmm.
which is actually the focus of the Northern Health Shield.
Yeah.
As
Exactly.
yeah, as we try to come with the health interventions, we also want to empower nurses, and that is we are dealing with unemployment altogether. So, thank you for able to put this idea together very well, and they see this. I think it's something that um, could lead to something good.
Absolutely.
Definitely.
Absolutely, and my hope is that and this is kind of the way that I see it growing, and maybe Warhana sees this, or maybe she doesn't agree, which is totally fine. But is kind of this idea where we get them to fund two, they see what we did in the district, then we choose another district, and they do all four on their own. Now, now we're really able to roll that out and make our network that much bigger, reaching four times more people. And so that's why I really want to hit it hard in that, and in the over delivery. I want them to see us under budget and over delivering, because if we do that, I can't imagine why they wouldn't choose us again. It just, it doesn't
Yeah.
logically make sense, right? I mean, you'd be crazy to have money and not give it to us, because if we succeed at this, we're touching, as Benny pointed out, on so many levels that they want to touch out on. It's almost as if we wrote the entire project for the grant.
Yeah.
So I think I'm very hopeful as well, and I think it's great work that everyone's doing in getting us the numbers, being the sounding board, and filling out the applications, getting the numbers, etc. The only thing that I hope to do in the coming days is to revise the remaining uh, health shield, Northern Health Shield documents around the RN positions and things, to make sure that they're in line now with the implementation plan, And so I hope to do that and get sign off on those in the Health Hub Discord in the coming days, so that we can then lock those further into our knowledge base and begin to create. The current versions are in there because I think they're relevant, but I just want to make sure that everybody looks at them hard and says, we're putting this into the knowledge base. This is what we're really trying to do. So I think that'll be great if we can do that in the coming days as well. And if there's anything else that you need from us, Warihana, please absolutely reach out.
Yes, most definitely.
Okay. All right. Thank you so much.
Of course, thank you.
Thank you. Yeah, just schedule another meeting or in Discord or wherever. We're here for you.
Okay. All right.
Very good.
Great.
Salam, go eat something.
Yes, go eat, my friend.
Ben, I'll call you. Can I call you tonight or I should call you tomorrow, Ben?
Okay, you can call me tonight.
Okay.
Yeah.
Yeah, and then
All right.
Warihana, just give me that address and I'll get it. So that and just remember that if I get address in there, it's that 7-day window. So you can keep changing it for those 7 days, but each time I have to put a new address in, it's a 7-day window.
Okay. All right.
All right, sounds great.
One real quick question. Did you guys get anything from Luke to sign regarding the board contract and being on the board?
Yes. I think I got an email, and that escaped me. Sorry.
Okay. No, that's fine. I am having trouble finding it in Smiley, and I know he's working, and so I was just going to check in with him tonight when he called to see if he's been able to do it. So that's why. Do you see yours, Ben?
No, I don't see an email yet.
Okay. I think the one you're thinking of, Salam, was a different contract that I needed you to sign.
This one
Okay.
had board. This one had like board job description in it, didn't it?
Yeah, it had their acceptance of the board and then the board job description. Yeah.
Okay.
Okay. I'll follow up with him then. Thank you.
Okay, great. Thank you, everyone. Have a great evening.
Bye.
All right. Bye bye.
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 Bye.